So there's a lot of different ways that you can hurt your biceps. Your biceps is the two different muscle bellies in the front of your arm. They're what you do for bicep curls. They help you bend your hand towards your mouth, and they help you bend your palm face up. And there's a lot of different ways you can injure your biceps. There are tendons above your biceps and tendons below your biceps that attach your biceps to the bones that it flexes, and you can injure them in either place. Picking up something really, really heavy all at once can snap your biceps in the distal portion. That's called a distal biceps tendon rupture. That almost always needs surgery. So if you feel a really tight snap and then you have trouble picking things up, then you might have a biceps tendon rupture at the distal end. You would have a lot of bruising if something like that were to happen, and if you do have something like that happen, come down and see us at Nadora Healthcare. We would take a look and potentially have to do surgery for that. You can also tear the biceps tendon at the proximal portion. This portion would actually give you shoulder pain, and if it snaps entirely, you would get what's called a Popeye sign. So your biceps on that side would actually look bigger than your other side. This one doesn't always need surgery. It kind of depends on what you need to do with your arm, what other strength you have, because there's other muscles that can do the things that your biceps can do. And so if you have a proximal biceps tendon rupture, we can talk to you about whether or not you need surgery. Other things that can happen is a lot of people with shoulder pain, especially as we get older and put more wear and tear through our shoulder, can have biceps tendinopathy in the shoulder itself. And so on the inside of your shoulder joint, your biceps tendon goes up into your labrum, and that portion of the biceps can get very irritated. And so if you have a lot of shoulder pain, it could be a sign of biceps tendinopathy. And biceps tendinopathy is treated by cutting out the portion that's causing pain and sewing the front of your biceps distally into the front of your humerus. And so it still allows you to use your arm normally, but it gets rid of that painful portion that's on the inside of your shoulder. So if you have a bigger biceps than normal, bruising, snapping, pain in your arm, anything like that, the first step would be to start stretching, see your primary care doctor. But if you're really worried about it and you're having trouble doing what you want to do, then we'd be happy to see you at Nadora Healthcare.